When we talk about minimum standards, we're talking about the absolute baseline of safety in healthcare. These standards exist to protect patients, staff, and the facility itself. Minimum standards are not suggestions, and they are not best practice. Minimum standards are the lowest acceptable level of care allowed. If a facility falls below minimum standards, it puts patients at risk, exposes staff to harm, and can face serious consequences such as citations, fines, or loss of accreditation. In sterile processing, minimum standards define how we clean, inspect, package, sterilize, store, and transport medical devices every single time. Meeting minimum standards is not about perfection. It's about consistency, accountability, and safety. It's important to understand that minimum standards are the floor, not the ceiling. In SPD, minimum standards mean instruments must be cleaned before they are disinfected or sterilized. Sterilization must always follow manufacturer's instructions for use. PPE must be worn when exposure risk exists. Environmental controls must be maintained. Documentation must be accurate and complete. There is no safe shortcut below the minimum. In healthcare, regulations and standards exist to set the minimum level of safety and quality that every facility must meet. Now, these rules aren't created to make your job harder. They exist because patients were harmed when standards weren't followed. Failure to comply with regulations doesn't just affect the hospital. It can result in patient injury, legal consequences, loss of accreditation, and serious professional consequences for staff. As sterile processing professionals, you are expected to understand the difference between mandatory regulations, things you must do, protect yourself, and practice with confidence. Standards explain how to do the job right. Regulations explain what happens if you don't. In sterile processing, compliance is not optional because every instrument you touch will be used on a patient who trusts the system. Understanding standards is part of being a professional, not just a technician. The goal is not to memorize every regulation today, but you are expected to understand why they exist. When someone questions why you're doing something a certain way, standards give you a clear, defensible answer. Standards turn good intentions into safe outcomes. Regulation. The CRCST 9th edition text defines regulations as rules issued by administrative agencies that have the force of law. So, a regulation is a rule that must be followed because it is backed by the law. Government agencies create regulations to protect patients, healthcare workers, and the public. In sterile processing, regulations tell us what we are legally required to do. Ignoring them can lead to fines, citations, loss of accreditation, or patient harm. Think of it this way. A regulation is the law. You don't get to choose whether to follow it. It's the minimum requirements for safe practice. Here's an example. OSHA requires technicians working in decontamination to wear appropriate PPE to protect against bloodborne pathogens. That isn't a suggestion, it's the law. Standard, a uniform method of defining basic parameters for processes, products, services, and measurements. A standard is an agreed upon rule or guideline that describes how something should be done to achieve quality and consistency. In sterile processing, that means it tells us the correct, proven way to perform a task, whether it's cleaning an instrument, packaging a tray, or operating an autoclave. Think of it as the recipe everyone follows to get the same safe, high quality result, no matter who's cooking. Best practice. Our text defines best practice as a method or technique that has consistently shown results superior to those achieved by other means. A best practice is the most effective and proven way to perform a task safely and correctly. It's based on research, experience, and professional standards that show what consistently produces the best results for patients and staff. In sterile processing, best practices are the methods that ensure instruments are clean, sterile, and ready for use every time. Here's an example. Using a type 5 chemical indicator inside every sterilization load is considered a best practice because it reacts to all critical parameters, giving a reliable confirmation that the cycle met sterilization conditions. Here's an easy way for you to remember these key definitions. Think of it as, do you have a choice? Do I have a choice? First, regulation. It's the law. No, you don't have a choice. Standard. Do I have a choice? Well, the standard is the recipe. It's usually expected. So you don't have a choice. Best practice. Remember, a best practice is the smartest proven method. It's always recommended. Here's some tips for the CRCST exam. When the exam asks about a regulation, think, what am I legally required to do? When it asks about a standard or best practice, think, what method provides the safest and most consistent outcome? So now that we understand these key terms, regulations, standards, and best practices, let's talk about where they actually come from. In healthcare, and especially in sterile processing, we don't just make up how we do things. The way we clean, disinfect, sterilize, and handle instruments is guided and sometimes required by outside organizations. These organizations exist for one reason: to protect patients and to protect you. Because without clear rules and standards, everyone would be doing things differently. And in sterile processing, variation leads to risk. If we don't follow regulations, patients can get infections, staff can be exposed to harm, hospitals can fail inspections. So this isn't about paperwork. This isn't about rules for the sake of rules. This is about consistency, safety, and accountability. Next, we're going to look at the key organizations that help define how sterile processing departments operate and what these organizations expect from you. Remember, regulations tell us what we must do. Standards show us how to do it right. Best practices help us do it consistently.